Welcome to my channel. Today we are going to talk about hemorrhage or bleeding. Bleeding is a loss of large amount of blood in a short period of time, which can lead to hypothalamic shock. There are two types of bleeding. There are external bleeding which occur outside the body caused by penetrating trauma, laceration, cuts, and gunshots. The second one is internal bleeding, whereby blood leaves from blood vessels and remain inside the body, such as abdominal cavity, brain, joints, and chest cavity. Can be caused by surgery, ruptured aortic aneurysm, fractures, and trauma. Now let's discuss about causes of bleeding. Wound, trauma, cancer, ruptured aneurysm, surgery, GI perforation, anticoagulants or thrombolytic agents, blood disorders such as hemophilia, viruses such as yellow fever or Ebola. Now let's discuss about laboratory and diagnostic findings of bleeding. They can do blood studies such as CBC, which will show decrease in hematocrit and hemoglobin. Also, they can do quack testing, which may detect alcohol in blood in the stool. They can also do CT scan of brain, MRI, endoscopy, angiography, colonoscopy, lumbar puncture, ultrasound, and prothrombin time PT and partial thromboplastin time PTT, especially for patients who are taking blood thinners such as warfarin or heparin or Plavix. Now let's talk about signs and symptoms of bleeding. Cold, moist, pale skin, abrasion, hypotension, tachycardia, oliguria, thirst, tachypnea, hematoma, ecchymosis, hematuria, which is blood in the urine, swelling, bruising, lightheadedness, dizziness, changes in mental status such as confusion, disorientation, and loss of consciousness, severe abdominal pain, especially for aortic aneurysm, saturated dressing with blood, slow capillary refill less than 3 seconds, cyanotic skin, diminished pulses, chest pain, shortness of breath, nausea and vomiting, occult, which is blood in the stool, hematoemesis, which is throwing up blood. Now let's talk about nursing interventions of bleeding. Call for help, ensure patent airway, give oxygen as ordered, do not remove a bedded object in the wound because it might cause further harm. Do not give anticoagulants or thrombolytic agents. Start CPR if needed. Apply direct pressure over the bleeding area. Apply tourniquet as a last resort. Apply medical anti-shock trousers, masks. Elevate the affected part of the body. Position patient in supine position. Start IV, large case usually 16. Administer fluid such as lactate ringer solution as ordered. Administer blood product as ordered. Insert Foley catheter and report urine less than 30 ml per hour to PCP or doctor. Use analgesics or narcotic cautiously because it can lower blood pressure. Assess patient closely, such as vital signs, skin color, central venous pressure, ABG, ECG, hematocrit, and hemoglobin. Do not remove dressing, instead reinforce due to clotting formation. Usually document. If you don't document, it means it did not happen. Now let's talk about treatments. First, treat underlying cause. They can do blood transfusion, fluids, surgery to stop bleeding, vitamin K injection, vasopressors to bring the blood pressure up. Now let's talk about complication of bleeding. It can lead to organ damage, coma, seizures, death, shock, hydrocephalus, infection, neurological deficits, increase in the cranial pressure. Now let's talk about hemorrhagic shock. It's a life-threatening condition due to severe bleeding. Treatments. It requires immediate care. If this happens, you have to activate emergency services. Also, fluid resuscitation, such as IV crystalloid or blood product, surgical interventions to stop bleeding, monitoring. It requires continuous monitoring, such as vitals and monitoring organ function. If you like my video, please subscribe and share with your friends. Thank you.